Okay, so imagine you're a heart surgeon, right? And you've just finished this like incredibly complex procedure. It's life-saving, you're exhausted, but you feel that sense of accomplishment.
Yeah, absolutely.
But then imagine that feeling is kind of overshadowed by this like nagging pain in your back or your neck.
Right.
Or even worse, maybe you have this growing concern about radiation exposure.
Yeah.
Well, that's actually the reality for a lot of professionals working in those cardiac catheterization labs,
Right.
those CCLs.
It is.
And it's a story that people don't often talk about.
Yeah, it's true. We often focus on all of the advancements, all the amazing things that are happening in cardiac care.
Right.
But we don't often think about the people performing them, day in and day out. What about their health?
Exactly. And before we go any further, we want to give a huge thank you to London Heartbeat Z Academy.
Yes.
For their support of this deep dive. They're doing incredible work, honestly, in cardiology education.
Amazing resource.
If you're listening and you're looking to learn more, stay up to date on the latest breakthroughs, you need to check out their courses.
Yeah, over 150 courses.
They've got over 150 courses covering everything from basic ECG to advanced interventional techniques.
Really runs the gamut.
Plus, make sure to follow them on Facebook, Instagram, Spotify, and YouTube.
Yeah, stay connected.
They have free regular updates, amazing discussions like this one. Honestly, you don't want to miss out.
You don't.
Okay, so back to our deep dive. Today, we're basing this episode on a 2023 survey.
Okay.
From Society for Cardiovascular Angiography and Interventions, SCAI.
Right.
It sheds light on some pretty concerning trends regarding the occupational hazards faced by these professionals in CCLs.
Yeah, so the survey had a response rate of 8%, 296 participants.
Okay.
Mostly interventional cardiologists in the U.S.
Got it.
It's not a huge sample size, but I think the findings still paint a pretty clear picture, honestly, of the challenges that these professionals face.
So one of the most startling findings is that nearly 60% of respondents reported orthopedic injuries.
Wow.
That's right, 60%. Almost 50% of these highly skilled professionals are getting hurt on the job.
Yeah.
And we're not talking about minor aches and pains here.
Right.
These are serious issues affecting their spines, hips, knees, wrists, you name it.
It's really concerning, and these injuries aren't just uncomfortable, right?
Right.
They can actually impact their ability to work and even their long-term health.
Absolutely. So the survey breaks down the types of injuries reported.
Okay.
25% reported cervical spine issues, probably from looking up at monitors all the time during procedures.
Yeah, constantly looking up.
Then there's the lumbar spine, 34% reporting problems, likely from all that standing,
Yeah, hunched over patients.
hunching. About 20% reported injuries to their hips, knees, ankles, wrists, elbows, shoulders.
It's not a pretty picture.
It's not a pretty picture, so think about this for a second.
Yeah.
These are the people we trust with our hearts.
Literally.
Literally, but they're being sidelined by the very work that's meant to help others. The survey found that almost 20% of respondents had to limit the number of procedures they could perform because of these orthopedic problems.
It's just not sustainable.
And get this, 21% had to take a leave of absence.
Wow.
Because of work-related health issues, physical and mental.
It really highlights the hidden cost, of all these advances that we're seeing in cardiac care. We're pushing boundaries, we're doing all this amazing stuff, but we're not always considering the impact it has on the people who are at the forefront of this progress.
It's a real catch-22.
Absolutely.
And the survey kind of drives this point home.
Yeah.
82% of respondents,
right,
a staggering 82%, said they would be able to work longer and delay retirement if these injuries were preventable.
Wow, so they want to keep working.
They're passionate about their work,
Uh-huh.
but their bodies are paying the price.
And what's even more concerning is that a lot of them, they feel like they have to just take matters into their own hands,
Yeah.
The survey found that a lot of these professionals are incorporating strength training, stretching, yoga, even massage therapy into their routines to try to mitigate these injuries.
So they're doing extra work outside of work.
Just to stay healthy enough to do their jobs.
It's like they're training for an athletic event just to go into the operating room.
It's really quite something.
It shows their dedication, but it also points to a pretty big systemic issue.
Right.
Shouldn't their workplaces be doing more to protect them?
Absolutely. It shouldn't be up to individual professionals to figure out how to prevent these injuries.
Right.
Healthcare institutions need to step up and create a safer work environment for these essential workers.
We expect them to be superheroes,
Right.
capable of performing these incredible feats of skill
Yeah.
without any regard for their own well-being. But they're human,
They are, and we forget that sometimes.
just like the rest of us, and their bodies have limits.
It's a good point. We put healthcare professionals on this pedestal, but we need to remember that they're not invincible.
Right.
They deserve the same care and consideration as the patients they serve.
Okay, so let's switch gears a little bit and talk about radiation exposure.
Okay.
It's a known hazard in this field, but the survey findings really reveal how serious this issue is.
Right.
While 83%, a vast majority of respondents said they wear their radiation badges regularly, a worrying 17% admitted to skipping them sometimes. Why would they do that, right?
Well, the survey offers some insight into this risky behavior.
Okay.
Some respondents admitted to skipping their badges to avoid going over those radiation exposure thresholds.
Right.
Which could then limit their ability to work. Can you imagine that pressure?
Wow.
Feeling like your job security is tied to how much radiation you're willing to absorb.
And this isn't just hypothetical. The 2023 survey found that 6.1% of respondents reported having been diagnosed with cancer.
That's a significant jump from the 2014 survey, which found it was 4.5%.
Wow, in just a decade.
That's a big jump.
That's a big jump. It's a sobering statistic, and it makes you wonder how many cases go unreported or undiagnosed.
Right. And then there's also the psychological toll of constantly worrying about those long-term effects of radiation exposure.
It's like a ticking time bomb.
It is.
Speaking of alarming statistics, the survey also found that 11% of respondents knew a colleague who had been diagnosed with a brain tumor.
Wow.
Now, we can't definitively say that this is directly caused by radiation exposure in the CCL, but it's definitely a red flag.
It is. It warrants further investigation.
Right, and it highlights the need for better preventative measures. The good news is that there are new technologies emerging that could offer better protection.
Yeah.
The survey mentioned low-dose imaging systems, RE-pad shielding, and even robotic systems.
Right. That could reduce the need for those heavy lead aprons.
Yeah, but here's the catch. Adoption rates for these technologies are still pretty low. Why is that?
Well, I mean, the survey highlights a few key barriers. First of all, cost.
Sure.
These technologies can be very expensive.
Right.
And hospitals are often working with these really tight budgets, but there's also just a lack of administrative buy-in.
Really?
Yeah, some institutions are just really slow to adopt new technologies, even if they could improve safety for their staff.
It's like they're saying, well, we've always done it this way, so why change?
Exactly.
But we're talking about people's lives.
Right. We can't just stick our heads in the sand and pretend that these risks don't exist.
Exactly. It's time to move beyond the business-as-usual mentality. We need to prioritize the well-being of these essential workers.
Yeah, they're on the front lines.
They're saving lives every day.
Saving lives every day, and they deserve to work in an environment that protects their health.
Short-term and long-term.
Absolutely.
Okay, so we've covered a lot of ground already, but we're just getting started.
Yeah.
In the next part of our deep dive, we're going to explore the unique challenges faced by women in CCLs.
Right.
Particularly those who are pregnant or considering starting a family.
Very important topic.
We'll also discuss what steps could be taken to create a safer, more supportive work environment for all professionals in this demanding field. So stay tuned. You won't want to miss the rest of this conversation.
It's going to be good. So welcome back to the discussion. I'm curious, what stood out to you from the first part of our deep dive?
Honestly, for me, it's just the sheer number of these incredibly skilled people, right? Experiencing these injuries. We're talking almost 60% reporting these orthopedic injuries and that worrying increase in cancer diagnoses. It's not just minor stuff either. These are serious issues that can affect their health long-term and their ability to do their jobs. I mean, that's pretty alarming, right?
Yeah, it's alarming. And I think what's really key here is not just how prevalent it is, but also the impact, on their careers, on their lives. 17% reported having to limit their time in the CCL because of radiation concerns. And almost 1 in 5 have had to cut back on procedures because of orthopedic problems. That's a huge portion of the workforce that's potentially being sidelined, right?
Yeah.
Or forced to make really difficult choices about their career.
It makes you think, if so many are having to limit their work already, what happens as these professionals age, right? And the wear and tear on their bodies increases. Who's going to perform these procedures then?
It's a good question, and the demands are only increasing too. The survey showed that since the 2014 survey, the median number of coronary and structural procedures performed has gone up, like significantly. Coronary procedures went from a median of 400 to 500, and structural procedures increased from 20 to 50. That's a huge jump in just a decade, and it's definitely going to have consequences if we don't start addressing these hazards, right?
That's 100 more coronary procedures a year. I mean, no wonder so many are having these orthopedic problems. It's like running a marathon every week and expecting your body to be fine with it. So what can be done, right, to protect these people? The survey mentioned those new technologies, but it sounds like adoption is still pretty low. What's the holdup? Why aren't these being used more?
Yeah, the biggest barrier seemed to be cost and getting the administration on board. Hospital administrators really need to start prioritizing the long-term health of their staff, not just the bottom line. Investing in these technologies might seem expensive, but what about the cost of all the lost productivity and sick leave, disability claims, even lawsuits down the line?
Right. But I get it. Hospitals are facing financial constraints, but there has to be a way to make this a priority. And it's not just about the money either. What about the impact on patient care if we end up with a shortage of skilled cardiologists? Because they're all injured or burned out.
Absolutely. It's short-sighted to just focus on the immediate costs and not think about the long-term consequences, right? And beyond that, we need to change the culture within these labs. It shouldn't be a bad thing to report an injury or to advocate for better protection.
So what would that look like, this culture shift? Like, how do we go from just talking about it to actually making things safer?
Imagine if ergonomic assessments were just routine, right? Not just something you have to do, where they're encouraged to use those new technologies, not seen as some kind of extra thing, and taking breaks, reporting even minor aches and pains, seen as being responsible, not like they're slacking off. That's the kind of environment that would not only protect these workers, but improve patient care overall.
I love that. A workplace where people feel like they can actually take care of themselves. Sounds like a win-win, right?
Yeah.
And it doesn't just have to be about fancy equipment and policies either.
Definitely. Even simpler things can make a difference. Things like making sure people are trained in how to lift things safely, making sure there's enough staff so people aren't getting burned out, having a way for people to raise concerns, without being afraid of what'll happen.
Right. It's about remembering that these professionals are humans, right?
Yeah.
Not robots. They have limits, they get tired, and they deserve to work in a place that supports their well-being. We can't expect them to do these things every day and not give them the tools they need to stay healthy. And speaking of well-being, I think we need to talk about the unique challenges that women face in this field, especially those who are pregnant or thinking about starting a family. We can't just ignore that 28% who said they felt discouraged from working in the CCL while they were pregnant. That's a huge number, and it points to a bigger issue within healthcare, I think.
Yeah, it does raise an important question. Are we really doing enough to support women in cardiology, especially when it comes to pregnancy and family planning? The survey findings suggest we have a long way to go. 71% of the women surveyed said they would want the option to step away from the CCL during their pregnancy, which again just shows that we need to be more flexible, more supportive, right, in our policies.
Wait, so you're saying that almost a third of women are basically being told they shouldn't work in this field if they want to have a family. That's crazy. It's like we're saying they have to choose between their career and motherhood, which is not okay.
Yeah, I think you hit the nail on the head there. We need to move past those old ideas, right?
Sure.
And create a workplace where people can be parents and have fulfilling careers. And let's not forget, we're talking about potential radiation exposure here to a developing fetus. On top of the physical strain of those lead aprons, which is already a challenge, these are things we need to be talking about.
Frustrating, right? We have all this talent, these amazing women in cardiology, and we're pushing them away because we're not making it work for them. Think about all the talent and expertise we're losing because of this.
And it's not just a loss for them, it's a loss for the whole healthcare system, for the patients. We need to create an environment where women feel like they can make the choices that are right for them without being punished or judged. So that means things like clear guidelines on radiation safety during pregnancy, offering options for, modified duty or temporary reassignment, and making sure they have access to affordable childcare and parental leave.
It's about building a culture that values everyone, right? Where people feel
Oh,
supported no matter what. And I think, talking about these hazards in the CCL, it's interesting how much these findings kind of mirror bigger issues in society.
Oh, interesting. What do you mean?
Well, think about the pressure these people face to put work above everything else, right? They're pushing themselves to the limit, sometimes it feels like, often at the cost of their health. mental and physical. It's like a smaller version of that hustle culture everyone's always talking about. Always working, always pushing, even if it means burning out.
It's a good point. What's the cost of all this striving for more and more? Are we sacrificing the well-being of our workforce, just to get more done in the short term?
That's the question, isn't it? And not just in healthcare, but everywhere. We need a better balance
Hmm.
between work and life, between reaching our goals and taking care of ourselves. If we don't, we're going to burn out our most valuable resource, the people who are helping everyone else.
I agree. True success isn't just about working more. It's about creating a life that's sustainable, one where we can thrive. And this brings up another point, I think. What about the impact of all this on patient care?
Oh, absolutely. If we have all these cardiologists who are struggling with injuries and burnout, it's going to affect patient care. Wait times could increase, access to those specialized procedures could become limited, the quality of care could suffer.
It's a domino effect, and it just shows how important it is to address these hazards. Not just for the sake of the professionals, but for everyone who needs healthcare.
It's all connected, right? The health of the people providing the care is tied to the health of everyone else.
Well said. And this is where we need to shift gears, I think, from just pointing out the problems to figuring out how to fix them.
We've done a good job laying out the challenges. But now what? How do we make things better? Where do we go from here?
For me, the key takeaway is that we need everyone involved. It's not enough for people to try and manage this on their own. We need hospitals, professional organizations, policymakers, even patients to all be a part of this.
So we need to go from awareness to action, right? Not just talk.
Exactly. We need concrete steps. That means things like advocating for better design in the CCLs, pushing for those new technologies to be used more, and creating policies that actually put the well-being of healthcare workers first.
And we can't forget about education either.
Right.
Making sure medical students know about these risks from the very beginning.
Early intervention is so important. If we can get people into good habits early on, maybe we can prevent some of these issues down the line. And this isn't just about cardiology either. This applies to every healthcare profession, really. And honestly, any job where people are doing repetitive movements, exposed to radiation, or dealing with high levels of stress.
It's a wake-up call, isn't it, for everyone? We need to prioritize the people who are taking care of us, not just for their sake, but for all of us.
It is. And this deep dive has given you a glimpse into this world that most people don't see. But it's so important to all of us. We need to talk about it more and start demanding better for the people who are dedicated to healing others.
It makes you think, about how all of this, what we've been talking about, how it might apply to other people in healthcare too.
Yeah.
Not just cardiologists.
Oh, yeah, absolutely. I mean, radiologists, surgeons, nurses, even dentists.
Right.
They all face these kinds of hazards. I mean, think about it. All that standing, weird positions, the repetitive motions.
Yeah.
And then on top of all that, you've got the mental and emotional stress of dealing with patients.
Right, who are often in really tough situations.
Exactly. So this survey, it's kind of like a warning sign,
Yeah.
for a much bigger problem in healthcare.
Definitely a wake-up call. We can't just focus on one specialty. We have to look at the whole
Right.
picture, or we're going to end up putting the whole workforce at risk.
Exactly.
And that means patients are going to suffer too, right?
Absolutely. It's all connected. And that's where this idea of everyone working together comes in. It's
Great.
not enough to just talk about it. We need to actually do something. So that means pushing for policy changes, supporting research into those new technologies, and building a culture of safety, in those healthcare institutions.
So what can we do as individuals, right?
Yeah.
How can we be a part of that?
Well, I think the first thing is to just learn about it,
Yeah.
And talk about it with people, with your friends, family, colleagues. Share articles, spread the word. Make it clear that this is something we need to be paying attention to.
Right, because the more people who understand what's going on, the more likely we are to see some real change.
Exactly. It's like anything else. You got to make some noise if you want things to change.
Exactly, and we can also support those organizations that are already working on this, right?
Absolutely.
Donate, volunteer, or just, help them get the word out.
Yeah, every little bit counts.
And don't forget, as patients, we have a voice too, right?
Absolutely.
When you're talking to your doctor, your nurse, whoever, tell them you appreciate what they do.
Yeah.
And acknowledge that it's hard work. Ask them how they're doing, Advocate for policies that will keep them safe. Let them know that you value them as people, not just as someone who's treating you.
That's so important, remembering that they're human beings, with lives outside of work.
Exactly. It's about seeing them as people, not just providers.
Exactly.
And remembering that healthcare is a team effort.
Absolutely. Everyone needs to work together. patients, providers, policymakers, researchers.
We need to build a system that works for everyone.
Exactly.
This deep dive has really been eye-opening for me. We talk about the financial side of healthcare all the time, but we don't always think about the human cost.
It's true. And those costs are real.
So we've talked about a lot today, haven't we? Like injuries, the cancer diagnoses, the challenges for women, that whole hustle culture thing.
A lot to think about.
But I think the biggest takeaway is that we can do something about it, right?
Absolutely. We all have the power to make a difference.
So as we wrap up, I want to leave you with this. What can you do in your own life to make things better for those healthcare professionals?
It's a good question.
Thank you for joining us on this journey. We hope you'll keep thinking about these things. Until next time, stay curious, stay informed, and take care.